Hello and welcome. My name is Daniel Ryan with the Charles Drew Medical GIS Laboratory, and today we will be looking at COVID-19 data and patterns over time in Los Angeles County. We'll be using Geographic Information Systems, or GIS, to look at geospatial data. First off, what is GIS? One definition by ESRI, the industry leader of GIS, states that a geographic information system is a system that creates, manages, analyzes, and maps all types of data. GIS connects data to a map, integrating location data with all types of descriptive information. This provides a foundation for mapping and analysis that is used in science and almost every industry. GIS helps users understand patterns, relationships, and geographic context. The benefits include improved communication and efficiency, as well as better management and decision-making. The geospatial data in the upcoming slides were created using ArcGIS Online, which is a cloud-based mapping and analysis solution. The COVID-19 data source for this presentation is the Los Angeles County Department of Public Health, or LADPH. This data includes cases, deaths, tests, and vaccinations. Cases, deaths, and tests are at crude case rates per 100,000 persons with a quantile classification in order to better see patterns in Los Angeles County. Vaccination rates are for the percentage of the population 12 and over that have been fully vaccinated and have a manual classification of 5 classes: 0 to 50%, 50% to 60%, 60% to 70%, 70% to 80%, and 80% and up. There are data limitations for test data, as the cities of Long Beach and Pasadena have their own health departments and do not report data on tests to LADPH. Other limitations include cities and communities that have extremely low to no population at all. Any unreliable data per LADPH is also omitted, and all data in this presentation is cumulative. As we see here is an outline of Los Angeles County, and we see COVID-19 data on this map is color-coded from the lighter shade, meaning low, to the darker shade, meaning high. The data is for Los Angeles County cities, communities, and unincorporated areas. The city of Los Angeles is depicted by communities within the city and not the city as a whole. These populations can range from large cities with populations over 100,000 to the aforementioned unincorporated areas with no population. Most cities and communities have populations in the hundreds, from the thousands to the tens of thousands. Outlining Los Angeles County on this map are numbered regions called service planning areas, or SPAs. A SPA, according to the Los Angeles Department of Public Health, is simply a specific geographic region within Los Angeles County. Due to the large size of LA County, it has been divided into 8 geographic areas. These distinct regions allow the Department of Public Health to develop and provide more relevant public health and clinical services targeted to the specific needs of the residents in these different areas. They include SPA 1, Antelope Valley, SPA 2, San Fernando Valley, SPA 3, San Gabriel Valley, SPA 4, Metro, SPA 5, West, SPA 6, South, SPA 7, East, and SPA 8, South Bay. We'll be spending some of our time focusing in on and around the area of SPA 6, which is the South SPA, highlighted in the red area of the outline. SPA 6 represents some of the most medically underserved areas in Los Angeles County. SPA 6 includes the cities of Linwood, Paramount, and Compton, and the communities of Athens, Hyde Park, Crenshaw, Florence, Watts, and Willowbrook, where Charles R. Drew University of Medicine and Science is located. We will be looking at the COVID-19 throughout different times in the pandemic. For cases, deaths, and tests, we will be looking at 4 different periods. April 2020, near the beginning of the pandemic, a time when the earliest data became available. June 2020, during the 2020 summer surge, hitting the milestone of 100,000 cases in LA County. February 2021, at the end of the 2020 to 2021 winter surge, and when vaccinations were first available to certain groups of people depending on age, health conditions, and job risk. In October 2021, after the Delta variant surged in the late summer and when vaccinations became more widely available to the public. We'll be looking at fully vaccinated rates for the population 12 and over at 2 different periods. July 2021, the early stages of the Delta variant surge, and November 2021, after the Delta variant surge. Taking a look at case rates, we could see in April of 2020 there's no discernible pattern. Cases are widely spread out as we were getting early data on the COVID-19 pandemic. 2 months later, in June of 2020, you could see a pattern beginning with case rates of COVID-19. Higher rates are culminating in SPA 6 and neighboring East SPA 7 and parts of Metro SPA 4, with smaller pockets in San Fernando Valley SPA 2, while more affluent areas of West SPA 5 and parts of South Bay SPA 8 begin to show lower case rates as compared to the rest of the county. In February 2021, you could see those affluent areas have the lowest case rates in the county, while those rates in SPA 6 and East remain high, while Antelope Valley SPA 1 shows an uptick of case rates. And in October of 2021, you could see the pattern sustain itself. Low rate in SPA 5, high rates in SPA 6, with a continual uptick in SPA 1. We can see over time, even with more messaging resources, a pattern begins to develop in COVID-19, with case rates in high-dense, heavily populated minority areas in SPA 6 and parts of SPA 7, and also growth in SPA 1. Looking at death rates in April 2020, COVID-19 deaths lagged cases, so early on there's no discernible pattern as COVID-19 deaths were spread throughout the county, and there was very few deaths countywide. In June of 2020, you could see a slight trend in SPA 5 having a lower death rate, but no distinctive pattern is forming. February of 2021, you could see a pattern of higher death rates moving to the east and forming in SPA 7 with an uptick within SPA 6, while SPA 5 death rates were lowering. And in October 2021, you could see death rates trending further east into the county, as well as SPA 1 rates begin to climb. We can see the deaths in Los Angeles County don't quite hold the same pattern as cases, but there's a small concentration in each part of the county and in SPA 6. As we look at test rates, a reminder that data is not available for the cities of Long Beach and Pasadena. If we look at April 2020, we could see a clear pattern early on as SPA 5 and SPA 8 have extremely high test rates compared to the rest of the county. Meanwhile, SPA 6 has extremely low rates. In June 2020, we can see there's a slight shift from west to east, but the west part of the county still has much higher test rates while their COVID case rates are dropping. In response to the lack of testing in SPA 6, Charles University implemented testing centers in SPA 6 that was instrumental, and as you can see, SPA 6 begins to improve their test rates. Meanwhile, SPA 1 sees a drop in test rates compared to the rest of the county. February 2021, the same dynamic continues with a push eastward where COVID-19 cases are plentiful. Meanwhile, SPA 1 test rates are the lowest in the county. And in October 2021, we see the numbers sustaining from earlier in the year. High test rates in areas that aren't as impacted by COVID-19, and SPA 1 struggling with low test rates more than anywhere else. SPA 7 and San Gabriel SPA 3 also have low test rates. Test rates are one of the more telling stories of the COVID-19 pandemic in Los Angeles County. Early on, there were a few places the public could get tested. Those with the means and access were able to get tested, while those with low access had to wait for more resources to be available. Even further on in the pandemic, you could still see the disparities in test rate. Vaccination rates in July 2021 show a very clear picture. SPA 6 and SPA 1 have the lowest fully vaccinated percentages for people 12 and over in Los Angeles County. Meanwhile, the coastal areas on the west side have the highest vaccination percentages for that same group. As you can see in November 2021, there's a slight improvement, but SPA 6 still lags behind the rest of the county, as well as SPA 1. There has been improvement in vaccinations in SPA 6. Possible explanations for the rise in short time may include mandates, better public health messaging and information, more resources, and a Delta surge that might have influenced people to get vaccinated. I'd like to thank UHI and a special thanks to Dr. Paul Robinson, Dr. David Carlisle, Dr. Kyosha Partlow, Caroline Faradolu, Dr. Roberto Vargas, and Dr. Sheila Young for this presentation and their efforts in combating COVID-19. And to view our gallery of geospatial health data, please visit gis.cdru.edu/CDU-GIS. And thank you all for joining me.